So many people in Africa, Nigeria especially, don't have that kind of access. Is there anything, and I know you from time to time you come to Nigeria to kind of give talks and see what you can do to bridge that gap. But what are some of the things that we can learn from what you're doing?
There is still a whole lot we can do, even in low resource communities. For instance, mammograms have been documented time and time again to save lives. And so if you imagine if a woman, or a community is getting regular screening once a year, mammograms, or even once every other year, which, some other communities recommend, this will likely lead to detection of breast cancers when they are at very early stages and more curable and need less intense and, if you will, less sophisticated treatments. And so in low resource settings, screening, really in all settings, but particularly in low resource settings, screening is essential to improving outcomes of patients with breast cancer. So if a cancer is detected at a very early stage and is the garden variety type of breast cancer being fed off estrogens, most of the time a woman would need surgery, perhaps radiation, depending on the type of surgery, and may just need, a 5-year course of anti-estrogen therapy and no chemotherapy, no targeted treatment. But of course, if that cancer is left to fester and is not detected at an early stage and progresses to stage, 2 or 3, then of course the interventions would become much more sophisticated and perhaps out of reach for the common man in Nigeria and in other low resource settings. So mammograms are absolutely key.